want to help in the treatment of COVID-19. Dr. Richard Tytus of Hamilton is part of a clinical trial right now, and he's looking for participants. Good morning to you.
Good morning, Annette. How are you doing today?
I'm doing very well, thank you. So this trial is for people who have not been vaccinated, whether it's for health reasons or religious reasons, or they just choose not to be vaccinated, right?
That's correct. So currently, when you go to see your family doctor, there are no treatments for COVID-19. They'll treat your symptoms, but we don't have any antivirals. And what this study is, it's about an antiviral to treat COVID.
Okay, and why can't you be a part of it then if you have been vaccinated?
Well, actually, there's a number of trials coming out. So one of the trials we will be working on is if you've been vaccinated, you are also eligible to be in the trial.
Okay.
Sometimes people get like a breakout infection.
Okay. So specifically then, you're looking for people who are quite close to your clinic near McMaster.
Right, something within the driving distance, so let's say 30 minutes.
Okay, and what does the study involve?
Well, what the study is when you do get COVID, you have to be isolated, you have to be under quarantine, and so what happens is that as soon as you get symptoms, you can call us, and the premise of the study is if you're treated early, it decreases the intensity and the length of the illness.
Okay, and this is a drug that has passed a number of hurdles already, and it's now at that clinical trial stage.
Exactly. It's really exciting because hopefully with the success of this medication, when you see your family doctor, the doctor will have a new tool in his toolkit to treat COVID-19.
And is it injectable or is it an oral drug? How does it work?
Yeah, the best part of it is oral. You take it twice a day. You take it twice a day for 5 days, and that's it.
Okay, and does it stop then the virus from spreading to other people? Does it kill the virus? It's an antiviral drug. I'm just trying to understand what that means.
Yeah, so what it is, it stops the virus replicating in your own body. And we have similar medications. For example, if you have the flu, we've got antivirals to treat the flu. If you get shingles, we have antivirals to treat shingles. So now we'll have an antiviral to treat COVID-19.
Wow, and is this like the only study of its kind in Canada right now for this?
Currently, there are a number of studies because manufacturers, the world, scientists have realized that this is an issue, and so there's a number of manufacturers coming out with antivirals to treat this.
Right, and I can imagine as we shift from pandemic to endemic, where COVID-19 is something we're going to have to deal with for a very long time, that this is another toolkit.
Exactly, because we don't know what the variants. So right now we're fighting the Delta variants. Vaccine's very effective. But what happens when we get to the Epsilon variant or other variants to come that we're not even aware of?
Okay, so if someone is watching then and is interested in this, what can they do?
Well, contact us. You can contact me at my office or on email, info@drtytus.com.
Okay, and this isn't the kind of trial where you go in right away and you're going to be treated with something. It's almost like a wait and see, like, do I get COVID-19, and then you go in.
Exactly. If you have the symptoms and you're treated positive COVID-19, call us and we'll come to you.
Okay, and then what if you're asymptomatic? How does that work? Or do you have to actually wait to present some symptoms?
Yeah, so the premise is that if you have symptoms, that we're going to come in and give you the medication, and because it'll decrease the intensity and the length of the symptoms.
Okay, and this isn't meant as kind of like an easy out for people who are not looking to get vaccinated, right? This is just another tool to be used.
Annette, absolutely right. Prevention, vaccination is the key. Prevention is the key, and I encourage everyone to get vaccinated.
Okay, but this is just another helpful event, and it's happening in Hamilton. So we'll get that information board up again, Dr. Tytus, and we'll get more information on our website at chch.com. Nice to talk to you again today.
Okay, thank you.